Well, victims of Savile's abuse say he was allowed to get away with it.
I feel that he knew he could do exactly what he wanted to do, where he wanted to do it and how. To me, because he was so sure of himself, that in the fact that when he was touching me and doing the things he did to me, there was never a doubt in his movements, in anything. So he felt safe being able to do what he wanted to do when he wanted to do it, without a doubt. He used to put his hand over my face as well quite a lot, and sometimes his fingers into my mouth, and that wasn't to keep me quiet, that was to reinforce. I knew what that meant. That was to reinforce his power 100% over me. It's unreal that somebody knows for a fact that nobody will tell him to stop. Nobody can tell him to stop. It's just wrong. It's wrong. He knew he had the backup from the hospital, I feel. He knew there that they were lenient on anything he done.
Well, joining us now live from central London is Dr. Phillip Lee. He's a Conservative MP and also a former doctor at Stoke Mandeville Hospital. A very good afternoon to you. Huge failings revealed today at Stoke Mandeville Hospital over many years, over nearly 25 years. What has shocked you most from the revelations that have come out today?
Well, firstly, particularly having just heard that painful testimony, I mean, my thoughts are with the survivors of this appalling abuse over so many years. It is quite remarkable when you read the report. I've managed to get through most of it in the last few hours, and it is difficult to sort of comprehend how senior management and senior clinicians were not aware of such extensive abuse.
Well, yes, does that trouble you? Because, as you say, we've got details of how people did come forward at the time, but the report suggests that there's no evidence that senior management did know. Does it trouble you that no one is seen to be responsible or held accountable for that?
It does, and I think going forward, I personally would like to see named responsible people in each hospital in this country, people who are ultimately responsible for this not happening on their watch. And indeed, if it does happen in the future, are then penalised for this. I mean, what happens to the pensions of the people who clearly were aware? I mean, the way that hospitals work, the idea that people were not aware of the rumours that were swirling around about this individual in the 70s and 80s, and it's quite explicitly stated in the report that the evidence is there that most people knew. The idea that people knew this and continue to receive their pensions, I think in the future, named officers, named clinicians, if this was to happen again, God forbid, they should be penalised for failing. And not knowing is also a failing of management. I mean, not knowing is not a defence.
So would you support a change in the law to make mandatory reporting of sexual abuse of children compulsory?
I think there are some issues around mandatory reporting. It's been knocked around Westminster for a number of years, I gather. But yes, I think we need to make some progress on that front. But ultimately, we need common sense. We need good, decent people with integrity, with a sense of honour, with a sense of responsibility in the system. No amount of legislation, no amount of regulation actually will create good people. And there seems to be an absence of good people in this report. Good in the true sense of the word, and I think going forward we need to find these people so that our hospitals remain a place of care, not a place of abuse.
Do you understand some of the reasons that were put forward for that happening? The fact that Jimmy Savile had this kind of prestige in the hospital because of the amount of money that he raised for the hospital. He was seen as such a big character. But also, you worked at the hospital yourself after the time of this abuse, I should stress. They saying at the time of the abuse it was run a little bit like a small town rather than a hospital. There were different departments which were their own fiefdoms in a way. Do you think it's credible that the news wouldn't have filtered up to senior management given the way it was run?
No, I don't really think it is credible. I mean, the site itself was massive. I think it was, I'm pretty sure it was the second largest hospital site in the country. So everything was spread out even when I worked there. And no, this report doesn't cover the period I was working there, but he most certainly was still wandering around the wards when I was a doctor there. And so there was clearly a cultural problem in the hospital. And this defence of celebrity, well, I can only speak for myself. I don't think someone being a celebrity is a reason to look the other way if they're committing abuse. I don't think that's a defence, and it's certainly one I would never use. And
you say still wandering the corridors when you were there. So did you hear the rumours in your time?
No, I didn't. And I think there's a difference between junior staff, and there is a culture around junior staff not rocking the boat, certainly was when I was there, and permanent staff who will have been around the place over a number of years. I personally found it rather odd that he had free rein. He was always alone whenever I saw him wandering around the wards. This didn't seem to be the case for other visitors to the establishment. And I know that occasionally there were sort of comments of, this is a bit creepy, why does this happen? But at no time was any specific allegation made. And I like to think if it had been, that I would have actually spoken up.
And some recommendations made in one of the reports today about the future, concerns that patients could potentially still be at risk at the moment, and a need for a tightening up of checks on not just relationships with celebrities, but also on volunteers. Do you support those recommendations?
I think whoever you are, when you're visiting a hospital in that capacity, be it as a visitor or a regular visitor or as a celebrity trying to raise funds for a particular unit, you should be subject to the same checks as anyone else. I don't think anybody needs to be treated in a special way. But I keep stressing, you know, it's T.S. Eliot, system so perfect no one needs to be good. You cannot put in place a system that's going to fully prevent this from happening. You rely upon good people displaying common sense and also taking professional responsibility. And that's what's shocking about this report in many ways. There aren't many names in it. And I'd like to know, why is that? It's one thing, of course, to keep the victims, the survivors of this abuse, anonymous. But it strikes me as quite rather odd that there isn't a single clinician's name that I've come across yet.
There are a couple of names of government ministers at the time, aren't there? There are questions for the health department at the time, aren't there? And the way in which they gave Jimmy Savile so much power at Stoke Mandeville.
There are, and there were similar questions asked around the Broadmoor report as well. Unlike the Broadmoor report, though, I've searched through the appendix. There aren't any sort of correspondence, letters from that period about him being given this position of responsibility around the National Injury Spinal Unit development. I'd quite like to see that, actually, because it would be interesting to see whether in those exchanges, in that correspondence, whether any insight was given into his applicability, you know, whether he was applicable, whether he was appropriate for him to be given this role. It's just not enough to say that he was able to bring in the money. I'm sorry, that's not a defence.
Dr. Phillip Lee, we appreciate your time this afternoon. Thanks very much indeed.
Pleasure.